are an agency. You've been hearing a lot about agencies. We have, I think we're the oldest agency. We were started in 1980. And we helped our first gay couple in 1982. So we have intended, if we have children born who are 30 already, and we have surrogates whose mothers were surrogates in our program. So we like to say we've had a big family. And in fact, 2 of those children are in my family. My sister's 2 children who were born through surrogacy. I always like to brag about that. But it changed my life and it changed my family's life. And we feel really blessed to have had that opportunity. So you've heard a lot about agencies. I can give you my overview of our program, but I thought maybe I might ask if you have some questions that you would really like to talk about instead. Do any of you have questions or?
You guys are based in Maryland?
Well, we have 2 offices because the main office is in California. I'm in Maryland, but the location really isn't relevant per se. It's where the surrogate lives and where you live. Since we do our consultations by Skype, we do want to meet you in person, at some point. But
So are most of the surrogates, you have all over the United States?
they're from all over the U.S. I mean, most agencies recruit surrogates from all over the U.S., with the exception, obviously, of those states where there's a problem legal. I mean, Maryland is a really good state, you may know, because for the opposite reason that California is a good state, where there's a law that recognizes the intent to become parents. In Maryland, there's no law. So there's no restriction. It's based on the precedent, the previous cases. Just it's not as big as California. So
How does Pennsylvania
Pennsylvania is a good state, with the exception of one particular county, Lancaster County. There's a judge in Lancaster County that isn't pro-surrogacy. So what we do if we have a surrogate who applies from that area is we see if she lives close enough to the border of that. Here you go. So that she could deliver in a different county. It doesn't mean she can't. It just we want to make it as easy as possible. Well, I did want to mention something that, as people were talking about what happens. One question: what happens when there's a difficulty with the relationship with your surrogate? And they were talking about the legal side and making sure. What we do that is really the foundation of our program and your safety net is we work with a team of counselors. They're a team of 6. There are 2 psychologists and 4 licensed clinical social workers. They don't work for the agency, but we work closely together. And they're critical. They are the ones that oversee most of the screening of the surrogate to determine, is this person a good choice to be a surrogate? And it's not just medical. Hi, thanks for joining us. Here, let me give you these. So they're very important. We start out with about 400 women who apply to the program on a monthly basis, and we'll end up with. Thanks for joining us. Here's just a little bit. We'll end up with maybe 12 or 15 of those by the time we've completed that screening, and that screening takes 3 to 5 months. So we've also gotten to know her well, but that counselor is really. Her client is their relationship, the space in between. So if you have a problem, let's say that your surrogate, you feel like she's not eating the right things, you're worried about that. First of all, in the contract, she's required to follow the doctor's orders. So it's not her decision or your decision. It's the doctor who says, this is what you should be doing or not doing. But if, let's say, your surrogate calls you up and says, oh, I can't wait to ride the roller coaster this weekend, and this never happened, but, and you're like, roller coaster? Really? You're 7 months pregnant with my child? Is that a good idea? And she says, oh, I rode the roller coaster right before my son, the day before, and okay, that's great, but this is my child. From both the surrogate side and the intended parent side, that counselor is there 24/7 for you to call up and say, I don't know, maybe I misunderstood her, but if the intended parents are worried about something she's doing, or the surrogates saying, you know, I don't hear from my intended parents very often. I'm the one that always has to initiate that call. That counselor's role is to guide both of you. If it's a legal question, you talk to the attorney. But that is critical to our program. Those are people who have all been working in this field for decades, really, decades. And they have a lot of experience in this type of relationship. So that's something I didn't hear them talking about so much that I think is important. And one of the panel, the last panel, when they were talking about the surrogate saying that she got to choose the intended parents, that's also how we do it. When that surrogate screening is completed, and we do everything but that last step where they call it the HSG, have you ever heard that term? Hysterosalpingogram, where they inject dye into the uterus and they look at it on an ultrasound so they can see if there are any lumps or bumps, unexpected lumps or bumps that might have a problem. We don't do that until we know who the doctor is. So when she's completing that screening, the counselors are looking at all of the pieces of the picture, what state she lives in, so the legal issue, how does she feel about terminating a pregnancy in the event there's something wrong with the baby, or what if she's pregnant with triplets? You know, how does she feel about letting you make the decision to reduce the pregnancy? Personality, other preferences. That's okay. Here, let me give you this. There are lots of those things that are important that aren't black and white, but that are something that if you're a counselor whose field of expertise is this, you know, if the intended parents are kind of quiet and a little bit on the shy side, they might be uncomfortable with the surrogate who's kind of a chatty Cathy, and wants to talk every day. So that's really, really important. That's something that we feel makes the journey a lot smoother. And we want you to have a really smooth experience. We don't want you to be chewing your nails off every day. And we don't want the surrogate to be feeling like, gee, my thoughts aren't being heard. Another point that may be different than what some of the others have said is in regards to choosing a surrogate independently. Unfortunately, the stories you heard were great, worked out well. But you have to be really, really careful when you take that approach, because you only know what they're telling you. And you don't want to be the one involved in all the screening and unraveling things, and because unless you have been doing this, it's not something that you have expertise. So when we get to know intended parents, we would ask you to plan to talk with us. We have a free introductory consultation, which takes 45 minutes to an hour, because sometimes people want to just see that there's a real person there and ask some questions. And then we ask that you have the full longer meeting, which takes about 3 hours. So you talk with me for a couple of hours. You meet with the counselor, and she's the one that's going to ask you all those questions. What is your expectation of this kind of relationship? How do you feel about terminating a pregnancy or reducing a triplet pregnancy? What about how many embryos you want to transfer? What about the relationship afterwards? Really important, because for the surrogate, believe me, she's not doing it for the money. I mean, she can go to McDonald's and get a job and make more money more quickly. She's doing it to get to know you and help you, and she wants to share it. And I'll also tell you that a lot of our surrogates, more and more of our surrogates, specifically request to be matched with a gay couple. First of all, there's not another woman there to compete with. and and couples who've been through years of infertility, and lost pregnancies and tests and IVF cycles. She knows that it's a privilege for her to help somebody that definitely can't do this themselves. Just really a thrill for the surrogates. I mean, that's why they sometimes will specifically say they want a gay couple. And of course, they know that since you're using an egg donor, the chance of achieving a pregnancy and having a healthy pregnancy is greater than having an egg donor who's in her late 30s. And she knows, she's going to be the expert, on all of that. So that's really important. So we try to balance the needs of the surrogates and their families with, what you need and what you want to be safe with and you want to be comfortable with, and you want to have a safe and healthy pregnancy, and So how many of you have children already? So this would be your first. And so do you all know other people who've gone through surrogacy? So you've probably learned some things from them, right? What advice have they given you?
Well, I have friends who did it in India, so
Mhm.
it's a bit of a different
That's a
process.
different,
But it took a couple of tries. Then we had triplets, so one of the babies had to be terminated. So
yeah.
there were a lot of decisions they had to make that they weren't prepared for.
There are a lot of forks in the road. One of our jobs is to educate you so that hopefully we never have to talk about those things again, but at least, you've got it here. It's something you've had a chance to talk about. Are you from another country?
Yeah, but US citizens.
Okay, because probably 2/3 of our intended parents are from outside the U.S., which is a whole
Right.
additional layer of things to think about. But insurance issues is another thing that we are all nervous about insurance. All of our surrogates, when we're presenting you with a surrogate, we've already determined whether we can use her own insurance. She gives us the full written description of all the benefits, and we review that. So if there has to be an exclusion specifically stating they won't pay for a surrogate pregnancy. Otherwise, it's legal. If it looks okay, we give it to the attorneys, and they review it, and they certify, yes, we can use this insurance. If we can't use her insurance, then during her screening, we'll assist her in applying for a policy. And we'll actually start that policy so that when you are meeting her, she's ready to go. Because sometimes there's a waiting period for insurance. The new health care bill has actually helped us because there's more opportunity for policies. It does mean that you have to pay for the monthly premium of the insurance, not just the copay and deductible, and we've found that to be about an average of $400 a month. But if that surrogate you're working with we've had to get a policy for her, we reduce her compensation by $2,000. So it doesn't always work out exactly even, but that kind of thing. Thank you. I'm trying to think of. Sorry.
Guarantee that the surrogate can get an Obamacare policy?
Yeah. I mean, if you've looked into any of that, it depends on where you live, what county you live in, and so forth. But yes, we have been very successful in getting those policies. The only downside is that you can't just call up any day of the year.
Right.
There's only certain open enrollment periods. So that's a little bit limiting. And again, that's why, we try to take our time with the surrogates. And
That happens once a year, right?
once a year, yeah. So it's just starting, I think, November 15th. So, that's the only downside to using that.
But if a surrogate is has insurance through the employer,
If we can use her insurance, we will use her insurance.
okay.
And you don't pay, that's what I'm saying, we review it and the attorneys review it and certify that we can use it. And you only then pay the copay or deductible if it's related to your
Right,
pregnancy. We try to put as many of the costs into boxes as we can,
right.
so that at least you have some expectation, like she doesn't get any extra expenses, money for expenses between the 6th week of pregnancy and the 32nd week. You know, the first 10 days that she misses from work when she's pregnant, she doesn't get anything extra, and she can only be compensated if the doctor has ordered her to miss time away from work. So we've tried to, you know, unfortunately we can't control haven't figured out how to control Mother Nature yet. But
What are the typical costs for your agency versus
the agency fees are a flat fee of $20,000, and that includes the case management, the trust coordination. There's no limit to the number of transfers or time frame involved. So you pay $8,500 when you first join the program. When we're matching you with a surrogate that you want to work with, we ask you to send $15,000 to your trust account. If you decide not to work with her, we just keep that money there, and then the rest goes in before the pregnancy starts. Okay. So thank you for listening. If you have any questions, give me a call or send me an email, and we'd be delighted to have a chance to help you.